name is Melanie. This is my health assessment video for WGU. This is my patient. Can you tell me your name?
Nicholas Bennett,
And your birthday?
January 9th, 2001.
Okay. Do you know why you're here today?
School physical,
A school physical. And how tall are you?
5'7",
And how much do you weigh?
159.2 pounds.
Okay. Are you having any pain today?
No, ma'am.
Okay. Do you have any complaints before I get started?
No.
Do you have any medical history?
Mm-mm.
What about family history?
Mm-mm.
Okay, so I'm just going to get started real fast. I've assessed him for alertness and orientation, person, place, time, or situation. I've asked him for his identifiers, his height, weight, and name. And I've asked about his pain, complaints, and history. I'm now going to assess his vital signs, blood pressure, heart rate, respirations, and then I'm going to run through a systems review. I have a couple of props today. I have a stethoscope. I also have a utensil for my tongue depressor. I'm going to use a phone for my pen light, and I'm going to use this muscle wrap for a blood pressure cuff. Okay, so let's get started. I'm going to assess my patient, look at his overall body to see if I see any malformations and see if I see any muscular skeletal problems. He looks even and symmetrical, well developed. His skin color is good, appropriate for his ethnicity. I don't see any apparent distress in breathing, no apparent deformations. So I'm going to check his skin. I'm going to look for color. I'm going to look for firmness. I'm going to check the skin turgor. Good, no tenting. Show me your hands. Your hands look good. No lesions or sores. Fingernails look good. Capillary refill is less than 3 seconds on both sides. No clubbing or ridges. I'm going to ask a few more questions, okay, Nicholas?
Okay.
Do you have any problems with your hair?
No.
Any pain?
No.
Put your head down, please. I don't see any lesions or soreness. Let me look at your ears. No deformities. How's your hearing?
It's good.
Any ringing in your ears?
No, ma'am.
Okay. I'm assessing the hair pattern on his eyebrows, his eyelashes, his facial hair, even distribution. The hair pattern is good. His eyes, I'm looking at the sclera are white. There's no facial drooping. Show me your nose. Lean back. Can you breathe well?
Yes, ma'am.
Put one finger on the side of your nose. Breathe out. Do the other side. Both mirrors are patent. I'm also going to look in your mouth, so I want you to bare your teeth. Open your mouth. Ah.
Ah.
And I want you to close your teeth. Smile. Puff your cheeks out. Checking cranial nerve 7. Looks intact. I'm going to check your gag reflex. Stick your tongue out. Say ah. Gag reflex is intact. Also, I notice that his uvula is in midline and rises evenly on both sides. I'm going to check his pupil reactions. I'm going to look in your eyes with a light, okay, Nicholas?
Okay.
Okay. I'm going to look at my nose. I'm checking pupils for evenness, round reaction to light. They are equal, round reaction to light. Look at my face. They both accommodate. Let me look in your mouth while open your mouth. Gingiva is moist, lips are moist. Any dental cavities?
No, ma'am.
No cavities. Any loose teeth?
No, ma'am.
Okay. Let's go ahead and check your blood pressure.
Okay.
I'm going to use my muscle bandage for that. Hold that for me. I'm going to place the bell of my stethoscope on his brachial artery. I'm going to now pump up the cuff slowly to about 140, and I'm going to slowly release, listening for heart sounds until I get a systolic and diastolic blood pressure. Very good. Very good. Let me see your arm. I'm going to check his radial pulse. I'm going to times it times 30 and multiply by 2. In the second half of the minute that I'm using, I'm going to be watching his respiratory rate and doing the same thing, 30 times 2. So at the end of the minute, I'll have a radial pulse and a respiratory rate. Alright, very good. Your heart rate's even and regular. Your respiratory rate is even and regular as well. Okay? I'm going to check your head and your neck. I've checked your face, your ears. I'm going to check your neck now for any lumps or tenderness. I'm going to check the trachea to see if it is midline. Are you having any pain in your neck?
No, ma'am.
Can you put it back, put it forward, put it side, side, turn, and turn. Now we're going to do the same thing, but I want you to try to push against me, okay? So push against me. Very good. And this side. Very good. Back. Very good. Forward. Very good. Any pain with that?
No, ma'am.
Okay, the last thing I'm going to check is your shoulders. You know how to shrug your shoulders? Okay, I'm going to put my hand and I want you to try to keep me from letting you shrug, okay? Very good. I'm checking muscle strength. I'm also checking for pain. The next thing I'm going to listen to is your lungs and your heart. I'm going to listen to the back and to the front, okay?
Okay.
So turn this way with your back to the camera. Okay. So at this point, what I'm going to be looking for is symmetry of the back. I'm going to look and feel to make sure that the spine is straight, and I'm going to look for overall muscle tone. And then at that point, I'm going to listen to the lungs. So this is my inspection. I'm going to listen to the lungs, and I'm going to touch them, and then I'm going to percuss the back. You ready, Nicholas?
Mm-hmm.
Okay. So I've inspected it. I'm going to now auscultate the lungs. Upper right lobe, upper left lobe, mid right lobe, lower left lobe, right lower lobe. Everything sounds good. I've done my palpation. I'm going to percuss. Listening for dullness or tympany. Any pain with that, Nicholas?
No, ma'am.
All right. Below the 12th rib, I'm going to check for the costovertebral angular tenderness. I'm going to do that with a closed fist, and let me know if this hurts, okay?
Okay.
No?
No.
Okay. On this side?
No.
Okay. So that's the back, and we're going to turn around to the front now. I'm going to do the same thing, only this time I'm also going to listen to your heart, okay?
Okay.
So my inspection includes the musculoskeletal. I'm going to look at it and see if everything looks good. Straighten up for me. Very good. I'm going to auscultate the lungs. Right upper. Left upper. Right mid. Left lower. Right lower. Everything sounds good. I'm going to check its apical pulse, which is going to be between the fifth and sixth space, intercostal space, below his mid-clavicular line. So there's 1, 2, 3, 4, 5. So I can hear his apical pulse. It's a little muffled. I'm going to have him lean forward. And it's much stronger now, and his apical pulse is strong. I'm going to listen for 1 full minute. Very good. Even and regular. Okay. And then now I'm going to percuss the front of his chest, and I'm going to check for tactile fremitus. I did forget to check it on the back, so we'll turn him around and check on the back as well. So I want you to look towards me, and I want you to say 99.
99. 99. 99. 99.
Very good. Percussing again for dullness, for tympany. And I want you to turn your back. And I'm going to do the back, the tactile fremitus.
99. 99. 99. 99.
Very good. Turn back around for me, Nicholas.
Okay.
I'm going to check the different valves in his heart. S1 and S2. Both present, clear. No extra sounds, no gallops, no rubs, no murmurs. I checked your hands and your fingers, so I'm going to check your brachial artery here where we took your blood pressure. This artery we checked was good. I don't see any further problems with your upper extremities. Let's check this one. And this one. Very good. Any pain in your arms or shoulders?
No, ma'am.
Okay. I want you to squeeze my hand. Pull me. Push me away from you. Very good. Now hold your hands like this. Push against me. Very good. Very good. Do like this. Up and down. Very good. I want you to lay down for me now, Nicholas, okay? While he's laying down, I'm going to be looking for jugular venous distension to see if I can see his any JVD in his neck. I'm going to move on to checking his abdomen, his lower extremities, and then we're going to do some walking. Is that okay with you, Nicholas?
Yes.
Okay. I'm going to turn this camera just a little bit. Here we go. So you can see it. Checking your neck here. Look up for me. Move his hair. No JVD present. I'm going to move down to his abdomen. Do you mind if I lift your shirt?
Sure.
I'm inspecting for any pulsations or anything like that before I move on. I don't see anything out of the way there. His stomach is flat. I don't see any masses, bulging, or anything like that. Are you having any pain in your stomach?
No, ma'am.
Okay, I'm going to listen to his bowel sounds in all 4 quadrants. His left upper quadrant. Left lower quadrant. Right upper quadrant. And right lower quadrant. Everything sounds good. I'm going to palpate and now percuss his abdomen. Move the... So first I'm going to light palpate each quadrant. Any pain with that?
No, ma'am.
Okay. And then I'm going to deeper palpate. Any pain with that?
No.
Okay. And now I'm going to percuss. And I see no peristaltic wave, and I hear no tympani. Let's move on to your lower extremities. So I'm going to lift your pant legs up just a little bit. Are you having any pain in your lower extremities?
No, ma'am.
Bend your knee for me. Very good. Bend this knee for me. Very good. I'm going to check the pulse in both of his feet. He's got a good, strong, present, and even pulse. I'm going to check the dorsal pedis behind, and I'm also going to check the popliteal behind the knee, present and strong. On this foot, same. Good pedal pulse, strong. Dorsal pedis and popliteal. I see no wounds, no lesions. Are you having any pain?
No, ma'am.
Flex your feet for me, back toward you. Now push away. Very good. Push out, push in, push down. Very good. Muscle strength is good. I'm going to check his capillary refill and his range of motion. But otherwise, symmetry, hair distribution, muscle tone, skin characteristics are all good. No edema noted. I'm going to tickle your foot, okay? So I'm going to check the Babinski reflex. Present. And then the capillary refill on the toes. Less than 3 seconds on both sides. I'm going to check the range of motion on his legs. Adduction and abduction are both good. Very good. I'm going to check this one. Very good. Okay. I want you to sit up for me, please. And the last thing I'm going to check is your neurological reflexes, and I'm going to check your spine, and then we're going to walk, okay?
Okay.
Okay. So I'm going to use this phone as a reflex hammer. Okay. So hang this on. There you go. Hang it. Very good. Very good. Very good. Sit back a little bit so that your feet are dangling just a little bit. Very good. Okay, I want you to stand up for me. Let's see if we can reposition our camera. I want you to walk normally. Turn around and walk the same way. All right, now I want you to walk that way, heel toe. Turn around and do it again towards me. Very good. Can you walk on your tiptoes?
Yes.
Walk on your tiptoes across the room. Pull your pant legs up just a little bit so they can see your heel, and walk back on your tiptoes. Okay. And now walk just on your heels. Pull your pant legs up again and walk just on your heels. Turn around and walk the other way on your heels. Very good. I think that concludes our health assessment video for today. Thank you for your time.